Hello everyone and welcome back to my channel. Today we will be diving into the topic of benign tumors of oral cavity. We will not only be learning the key identification and the histological features of the particular tumor, but also my favorite part. I would be giving you all a quick memory tip to instantly recognize the particular slide or image in your exam. So let's get started, guys.
So our first tumor for today is your Cavernous Hemangioma. It is a benign vascular tumor. The most common location it is found is in tongue, lips and buccal mucosa. What are its key histopathological identifying features? First is it has large dilated vascular spaces lined by single layer of flattened endothelial cells, as we can appreciate it in the diagram. It is filled with RBCs and minimal connective tissue stroma between the vessels. So the three main features that you have to remember is one, it has got large dilated vascular spaces, has a single layer of flattened endothelial cells, and it is filled with lots of RBCs. So what is a quick memory tip? If this slide looks like a honeycomb of huge blood lakes with very thin walls, like if you see in your slide like honeycomb appearance, then it will be your cavernous hemangioma. The next is your capillary hemangioma. So hemangioma are of two types, cavernous and the capillary one. Now we'll understand the difference of how to identify whether it is cavernous or your capillary hemangioma. The capillary hemangioma is also a benign vascular tumor that is made of small capillary sized vesicles. The common oral site is lips, gingiva, buccal mucosa and tongue. Now what are the histopathological features? It has numerous small sized capillary blood vessels that are packed closely, as we can appreciate it over here in the diagram. See all these. Second, the lumen contains RBCs, more fibrous stroma compared to your cavernous type, and it often shows lobular arrangement of vessels. So what is the quick memory tip? Small, tightly packed red filled tubes like a bunch. That would be your capillary hemangioma. So this is the key identifying features, the difference between your cavernous and your capillary. In your cavernous hemangioma, the connective tissue stroma will be less and you will have large dilated vessels that you will see. In your capillary hemangioma, what will you find is small sized vesicles or the capillaries that has been found. The next one is papilloma. It is a benign epithelial tumor that is caused by hyperplasia of stratified squamous epithelium that is linked to HPV type 6 and 11. Now what are the common oral sites? Tongue, lips, buccal mucosa and soft palate. Now the histopathology key features that we will find is it has multiple finger-like projections with a central fibrovascular connective tissue core. Overlying stratified squamous epithelium, it may be keratinized or non-keratinized. Surface hyperkeratosis is common in your oral lesions. Coliocytes may be seen in HPV-related cases. Quick memory tip, white rough cauliflower or warty-like lesion. So as we can see over here in the diagram, we can see these are your multiple finger-like projections. Then these small, as we can appreciate here, are your coliocytes. So coliocytes, they usually resemble resin in its appearance. Now there can be hyperkeratosis and acanthosis. So what are these two terms? Hyperkeratosis means increase in the keratin layer. When the keratin layer increases, that is your hyperkeratosis. Acanthosis is the increase in the thickness. If the cell's thickness is increased of each layer, that is your acanthosis. So these two features can be seen in your papilloma. The next is your lipoma. So it is a benign tumor of mature adipose tissues. Buccal mucosa, buccal vestibule, tongue and lips are the common sites where lipoma can occur. What are the key histopathological features? It contains lobules of mature adipocytes that has clear cytoplasm with peripherally placed nucleus. So if we draw one adipocyte, it is somewhat like this. It will be seen. This is your clear cytoplasm and this is your peripherally placed nucleus. Lobules are separated by thin fibrous connective tissue septa, as we can appreciate it over here. It is covered by stratified squamous epithelium if it is submucosal. Now quick memory tip for this, my students, it is big white bubbles with tiny cores of nucleus that will be your lipoma. So what will you see in the slide is you will see adipocytes with a peripherally placed nucleus. Here next is fibrous dysplasia. It is a benign fibro-osseous lesion where normal bone is replaced by fibrous tissues of immature bone. Common oral sites, maxilla is more commonly affected than mandible. One key identifying feature of fibrous dysplasia in your X-ray is it will have a ground glass appearance. So when sometimes in your MCQ exams they ask that so and so patient in the X-ray a ground glass appearance was seen, that will be a fibrous dysplasia. Now what are its key histopathological features? It has fibrous stroma that is composed of spindle-shaped fibroblasts and collagen fibers. Scattered irregular trabeculae of immature or the bone. Over here we can see these are all your scattered immature trabeculae of your woven bone. Trabeculae are often curvy linear, that is Chinese letter pattern. That is also a key feature. Chinese letter, like we cannot understand it is written in which language. So all these, this is a Chinese letter arrangement. Bony trabeculae lacks the osteoblastic rimming. This is also important feature. So Chinese letter pattern trabeculae of immature, the bone scattered everywhere, and you will see there will be lack of osteoblastic rimming. Now quick memory tip is think Chinese calligraphy written in a fibrous background. Over here you have to draw this diagram in your exams, and there will be no capsule. The lesion will blend with the bone. Your next is chondroma. It is also a benign tumor of mature cartilage. Common oral site, it rarely occurs in jaws, but whenever it is present, it is found in anterior maxilla or mandible. Now what are its key identifying features? Lobules of mature hyaline cartilage, chondrocytes in lacunae arranged singly or in small clusters. Over here, see, single or it might be in clusters. These are your chondrocytes. Abundant homogeneous basophilic matrix, that is a cartilage matrix. So the slide of chondroma will usually appear bluish to purple in color because it has got abundant homogeneous basophilic matrix present. Peripheral areas may show calcification. It is well circumscribed, often with fibrous connective tissue surrounding it. Blue-purple glassy ocean, if you see like there are too many lacunae with blue or purple color side, it will be a chondroma. Here next is lymphangioma. It is a benign tumor of lymphatic vessels. Common oral sites, tongue, lips and buccal mucosa. Now histopathology key features. Numerous dilated lymphatic channels. See, we can see over here dilated lymphatic channels of varying sizes. Channels are lined by flattened endothelial cells. They have got flattened endothelial cells. Lumina contains proteinaceous lymph fluid which is clear. Minimal RBCs in lumen. So what are the key features? Dilated vessels you will see in lymphangioma. Even your dilated things are found in cavernous hemangioma, but cavernous hemangioma will have RBCs. Lymphangioma will not have RBCs, like very minimum RBCs. So it's written that will help you distinguish from hemangioma. Quick memory tip, many clear empty channels, that is lymph vessels, will be a lymphangioma. So don't get confused between a lymphangioma and hemangioma, chondroma and lipoma. So with this guys, we complete all the 7 benign tumors of oral cavity.